So what is Medicare Advantage, Adam, and how does it actually work differently from original Medicare with a Medicare supplement plan or Medigap, and specifically at the point of care, focusing in there?
So Medicare Advantage is a private version of original Medicare. It's a privatized version, very simply. So I like to think of it as, the federal Medicare program, which is the original A and B, was developed for, it would kind of be thought of as like a one-size-fits-all almost, right? It is what it is.
Right.
It's only going to do what it's going to do. It's not customized for different people. And we know that there's all kinds of different needs and different unique situations for people around the country based on where they live, based on their travel habits, based on their health, based on their other health benefits they may have, their budget, all kinds of factors. Do they have military health benefits, right? Do they have employer-sponsored coverage? Right? There's just so many elements to it. Are they lower income? Right? Income's a factor. Do they have maybe chronic health conditions? And so what happened is with original Medicare, it's limited based on what it's going to cover. I already highlighted some of that, like dental, vision, hearing. That's a pretty important component of somebody's health care that's not included in there for routine services. So we know that one shoe doesn't fit all feet.
Right.
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 We know that from the Cinderella story, right? It didn't fit a lot of those girls, but it fit the one. Original Medicare is the same way. It might work perfectly for some people out there, but might be other people that feel they need a different size shoe, right? Maybe they need something more comfortable,
right?
Maybe they got really big feet. These are analogies here to say that Medicare Advantage is the ability to basically choose a customized plan and get all the same rights, benefits, and guarantees that you could get through the original program, but now you get it administered through a private insurance company who has to follow the regulations and the rules set forth by the federal government. So they have to actually design and build their plan. So they go to market and they say, okay, we've identified this segment of the market and that's who we want to serve, and we're going to design this plan to serve these people, right? They got to submit it now to the federal government for approval. They have a short window to do this.
Right.
There's a lot of moving parts behind the scenes. And so they got to submit it for approval, get approval, now they can offer that plan. It has to meet the bare minimum standards, but they can customize it. They can add additional benefits that may not be included by original Medicare, and they can allocate some of the financial resources to maybe improve certain elements of the plan and maybe kind of take away from another area. Hence, customizing it for a group of people where it would be a really good fit for them, but it might be a really poor fit for another group of people. And that's, I don't want to get too far ahead of ourselves, but that's why some of these people are out there shouting Medicare Advantage is evil, right? It's the devil, and anybody selling that is bad. Well, a lot of people selling it don't know what they're doing.
Right.
And they don't understand how to help consultatively find out where this person's at and what their needs are and pair them with a solution. And that's what it's designed to be, is a menu of options now that somebody can choose that allows them to customize their coverage yearly. That's the other great benefit, is some people will paint that as a negative. They'll say it's horrible because it could change. Yes, but if it changes, there's a bunch of other options that may be available in that area that now you can change to. In the financial advisory world, a lot of people talk about some insurance products and say these things could change every year. Some people paint that in a bad light, but the financial advisory people might say, well, that's a good thing because now we can help you customize it based on the road ahead and where the environments went. Let's get you allocated differently now and get you optimized for the future. Right now you're going to win. So that's the positive side of it, the positive way. Now the negative side, I think to really answer the question, though, you said at the point of service, right? One of the benefits of original Medicare is there's no insurance involvement from the standpoint of like somebody approving or denying a service. Well, they're starting to add some obscure prior authorizations now, but for the sake of conversation, you can just really go to the provider, doctor, and say, hey, you need this done, and go get it done. And if it's a Medicare service that's approved, they're going to get it done, right? They don't have to get a prior authorization approval from an insurance company to get that service done. Contrary to Medicare Advantage plan, many of them will have prior authorization, some more than others for different services. And that can be a hang-up. But, we can talk all day long on these type of things, but it's important to understand that most people coming into Medicare eligibility have always been on a managed care plan prior. They've had to deal with networks, prior authorizations. For most people, they've had to deal with coverage that wasn't really good compared to what's available through the Medicare plans, Advantage plans in particular. So there's pros and cons to both.
Okay. And so the Advantage plans then sounds like it's, federal contract with the government, right?
Right.
It's an agreement, and like you said, they have to cover a minimum they have to cover the minimum, right? Which is why they can offer all the same rights, benefits, and guarantees of original Medicare. So I feel like there's a pretty prevalent narrative out there that when you enroll into an Advantage plan, you're actually getting less benefits. But it just sounds like from what you explained there that that's not the case at all. In fact, not only do they get all the same rights, benefits, and guarantees, they're also getting the option to have extra things covered as well. So more than what Medicare covers.
Potentially, if that plan has done so.
Got it.
Right? And they may or may not have extra benefits, but it is definitely an outright lie to say that you don't have the same level of rights, benefits, and guarantees. They have to.
Mm-hmm.
They're submitted to the federal government, who has to literally approve that plan to be offered to the public.
Right.